Nations across Europe are closing their borders to England following the discovery of a new variant of COVID-19. Scientists are still studying the rapidly spreading mutation, but it is believed to be highly contagious. Ian Lee reports from London, which locked down on Sunday.
It was a mad dash to the exit as travelers tried to flee London. The UK went into a strict lockdown on Sunday after a mutant strain of the coronavirus caused cases to spike.
Given the early evidence we have on this new variant of the virus, the potential risk it poses, it is with a very heavy heart. I must tell you, we cannot continue with Christmas as planned.
Much of England's southeast, including London, is the epicenter of the new outbreak. Health officials say this latest strain is 70% more transmissible, and hospitals are being overwhelmed. The news caused chaos at borders as countries closed their doors. Germany, Italy, and Canada join a long list of countries banning flights from the UK. France also put the brakes on travel. Now thousands of trucks with holiday goods are stuck at crossings. While the virus spreads more easily, it doesn't appear to be more deadly, and doctors believe the vaccines should work against it.
This is not the time to panic. In all likelihood, this is just another mutation that leads to another strain, and that is what we have seen throughout the pandemic.
Currently, World Health officials have discovered 4,000 mutations of the coronavirus. So far, the 2 approved vaccines are believed to prevent all of them. Ian Lee, CBS News, London.
Earlier today, a member of President-elect Biden's COVID-19 advisory board spoke to CBS this morning about the new coronavirus variant. Dr. Michael Osterholm is the director of the Center for Infectious Disease Research and Policy at the University of Minnesota. He told our Jamie Yukas what makes this strain so contagious.
Well, what happens is, in part, the virus actually may grow to a much higher level in an individual's throat and respiratory tract. And there's actually data from England supporting that the people who are infected with this strain actually have more virus, which then might very well make them more infectious. And if that's the case, all you have to do is increase even marginally the number of people that any one individual infects. And then you have potentially very rapid growth of the virus in the community that wouldn't have happened otherwise. And that, I think, is what's actually being seen right now in England.
I want to bring in immunotherapy scientist Dr. Leo Nissola. He's an advisor for the nonprofit COVID Act Now, which provides Americans with local data about the pandemic. Dr. Nissola, welcome. Great to have you with us. So UK health officials say this new variant is 70% more infectious. Does that necessarily mean it's more dangerous? And to what extent has it been studied at this point?
Thank you for having me. I'm happy to be back. Well, there are many unknowns. There is no shortage of things that are not clear yet when it comes to this new strain. Well, we do know that this is a mutation, and we do know that this mutation seems to be more infectious, as you pointed out. Companies that have developed those vaccines and the treatments for COVID-19 have already put out statements saying that they are confident that this new strain will be covered under these new drugs, the therapeutics and the antibodies, and also the new vaccines. So 70% of more infectious rate for us means that we have to be more careful. We have to be more cautious in terms of spreading this disease even further. Because in the United States, we don't know if this strain is already here or not. We don't have those tests. So when folks talk about potential travel bans, like Canada just announced recently, Italy, the Netherlands, and Belgium, my concern is the U.S. has become the epicenter of COVID-19. Do we know for sure if this new strain is not here yet? And I don't think we have the answer to that question.
So you referenced the vaccine companies already issuing statements because many people are worried when they hear the virus is mutating. Tell us more about how the technology and the science behind these current vaccines can help counteract any mutations that this virus may develop.
Right. Well, one question that we do have is in case this mutation is due to selective pressure or this mutation is because the virus has actually changed into something different. So we still don't know. What we do know is that we need to understand what has happened to the virus spike proteins. And because of this new technology of these new mRNA vaccines, because it's synthetic, it's quite easy to upload new information and to make sure that these spike proteins are covered.
That is good news. Doctor, the British government had reportedly been had reportedly been trying to persuade the Trump administration to lift the travel restrictions that are currently in place, blocking UK citizens from entering the US. In your opinion, do these sorts of travel bans work?
Well, travel restrictions could mean many things. It doesn't necessarily mean stopping people from traveling, but perhaps increasing the mitigation risks on making sure folks that are traveling to the United States are tested negative for COVID-19 and self-quarantine upon arrival, and perhaps have a rapid test that turns out negative in the US as well. So, again, we don't know if this new strain of the virus is not here yet. So in case it is, the travel bans would not do us any good.
Right. So new research from Stanford finds that when cities have reopened full-service restaurants, the number of coronavirus cases increased there more than in any other setting they studied. Yet there are some who argue restaurants should stay open since contact tracing data shows that most coronavirus clusters come from household spread. So are people interpreting this data correctly? What is the correct way of looking at it? Are more people getting infected outside in small enclosed places or inside their home when they let down their guard and others come in and take off their masks?
In my opinion, this study just proved what we were suspecting all along. Indoor environments, whether they are restaurants, gyms, churches, bars or cafes, they are prone to poor ventilation. And we know that this virus loves indoor environments. So in my opinion, we should actually make sure that everyone is immunized against this virus before we think about reopening indoors. This study was very well conducted, and I trust the findings. So in my opinion, I think that indoor dining should be put on hold.
All right, that is very useful information. And Doctor, the first shipments of Moderna's coronavirus vaccine, as you know, are currently being distributed across the U.S. We know the first shots are going to healthcare workers and residents of long-term care facilities, as I think most people would agree they should be. But who is likely to be included in the next priority category?
I think healthcare workers, elderly, and the vulnerable populations we can all agree on. One thing that I think it's important for us to discuss is reopening our schools. And in order for us to safely reopen our schools, we need to make sure that our teachers are immunized. So I think a great mission for next year is to make sure that kids can get back to school. They cannot lose another year of their life without going to school. So I would advocate for teachers to be able to get a priority access to this vaccine as well.
I would agree with you on that one. I think a lot of parents would agree with you as well. Dr. Leo Nissola, thank you so much for joining us.
Thank you for having me.